on my squat, my pistol squat. If you want to work on this at home, this may be helpful to you. We're trying to restore the leg's ability to maintain an alignment of the knee between the foot and the hip, and avoid having a situation where the knee moves toward the inside of the line that connects the foot and the hip. There's a variety of problems that are created by this alignment. What you want to do to achieve the best muscle patterning is to activate the muscles that keep your arch from falling, which would be these muscles here. You can see my foot is tilted onto its outer edge. But in order to get the most efficient pattern, you want to have the rear foot turn onto its outer edge, with the forefoot maintain contact with the ground, which is going to cause your foot to have a posture kind of like the way I've oriented my hand, rather than having it tip onto its edge, which doesn't use the same pattern of muscles, as having the pressure being on the outer edge of the rear foot, but the great toe still be in contact with the ground. In addition, you don't want to have your toes claw the ground. You want the pads of the toes to be in contact with the ground and not the tips of the toes. Rather than say pads, it would be more appropriate to say the ball of your foot rather than the tip of your toes. I'm choosing to do this with shoes on because I want a little extra help from my shoe, because I'm not really good at this. I haven't done it for a while and I need to spruce it up. I'm going to use these handles here to help me, use my upper body to help me execute the movement. So here I am, I'm going to stand on one foot. I'm looking down from above. If I had a mirror in front of me or a big TV screen showing my image, that would be great, because I could be in an upright posture like this, but I don't have that, so I'm just going to look down. I've got my rear foot on its outer edge, and I still have the bottom of my big toe in the pad of the foot contacting the ground, and I'm going to lower myself like this. If I put my foot out in front of me like that, it has a different effect than if I put my foot like this. If I put my foot behind me, I find it easier, probably because I can use my gluteals a little bit more, and that takes a little work away from my distal quadriceps. And so you choose to do whatever technique allows you to have a good posture of your foot, a good alignment of your leg. And you can see as I lower myself down, it's difficult to keep my weight on the outer aspect of my rear foot. It's shaky. So I'm going to use the easier of the two ways for now. A little more difficult, biasing more of the distal quadriceps would be this one. Here, my upper torso position is a little different because my leg's going behind me. I can get better form, and I'm pretty shaky, but it's still doing some good. That was a good rep right there. You can see my ankle adjusting as I do this. I'm trying to keep it on its outer edge. Pretty good like that. Okay, I'm going to make a target of about 10 to 15 repetitions. And if I get 10 to 15 off and they look pretty good and I'm happy with them, I might change my opposite leg position to in front to make it more challenging. I haven't spoken about depth. I would tell my patients to use comfort as a guide, so try to avoid reproducing the pain they're wanting to get rid of, so adjust the depth in accordance to that. Form would be another thing that would determine depth. The other thing I haven't mentioned is alignment of your knee relative to where your foot is. It's a common sentiment that says don't allow your knee to go past your toe. I'm presupposing that comes from the idea of loading the back of the kneecap, which will happen to a greater degree if your shin assumes an angle that's more angled like that. Also, you may utilize the gastrocnemius muscle, the calf muscle, if that happens, thereby taking away a little work from your target muscle, which in this case we're endeavoring to make the distal quadriceps in addition to the stabilizers of the ankle. So, as I'm executing the movement, I'm watching my knee. My shin is staying fairly vertical. It's really not going forward very much. If you look at it from the side, it'd be going from vertical to a very slight forward slope, not a huge amount. So there's a bit of dialogue in regards to your objectives, some criterion and some verbiage you can use with your patients, some adjustments to make it more difficult, a little less difficult, more well matched to your client's abilities, and a little bit of help here. So I hope that helps you get more out of a single-legged squat for enhancing lower extremity biomechanics. Thanks.